Hi, I am Dr. Erin Stubblefield here with the KMC University HelpDesk. Sometimes, the longer we are in practice, we may start to get a little lax. Maybe we forget to ask pain scales during a patient encounter, or we miss questions on how the patient has been since the last time they were in our office. And our notes might start to get a little questionable. Recently, one of our doctors asked for some simple principles when it comes to patient documentation, principles that will elevate the quality of your documentation. So we're going to review 5 principles to remember every time you are documenting. Principle 1 is specificity. Detailed observations about your patients can help create a clear picture of their progress and treatment response. The patient presented antalgic is okay, but the patient presented antalgic to the left, using their left hand to support their trunk, and displayed a grimace when walking to the treatment room is much more specific and paints a much clearer picture of the patient's perceived severity of pain. The second principle is just consistency. The second principle is consistency. Adopting a standard documentation format that includes accepted medical terminology and keeping that format with each note enhances clarity and minimizes any chance for misunderstandings, regardless of your audience. So find a way that you like to chart and a way that you like to write your notes, and just be consistent with that every single time with every single patient. Principle 3 is tracking change. So making sure to carefully document any changes in your patient's condition. It's really important to track any change, even if it's considered quote unquote bad. Having a complete record allows you to make informed clinical decisions and ensure any timely adjustments to your patient's care. Principle 4 is accuracy. Accurate and comprehensive notes not only protect your practice, but also uphold ethical standards in patient care. Omitting or falsely reporting information is a one-way ticket to audit town, or worse. So keep your notes compliant by always accurately reporting patient information, even if you don't think that it's important in that moment. And principle 5 is individualism. So it's okay to personalize your notes. After all, it should be patient-specific. So tailoring your observations to reflect each patient's unique circumstances will foster a compassionate approach to care. The important thing is that your notes need to be impactful, because impactful notes hinge on specificity, consistency, tracking changes, accuracy, and individualization. These 5 principles, by weaving them into your documentation routine, you're going to enhance patient care and safeguard your professional integrity. Embrace these principles for a better healthcare experience, not just for you, but for your patients as well. So, if you enjoy this content, follow KMC University on all our social media platforms for more practice tips from the chiropractic, reimbursement, and compliance experts.